You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emran, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. I'm your host, Dr. Emran. Today I have a very special guest with me at my clinic, so I'll let him introduce himself.
Hello guys, my name is Faaiz Siddiqui. I go to the University of Houston, and I'd like to thank Dr. Emran for having me on the show today.
All right, thank you for being here, Faaiz. So Faaiz is a pre-medical student, and he and I have been seeing patients for the past week together. So there was a patient that came in last week that he wanted to ask me some questions about. So I'll let Faaiz describe the patient, his age, and sort of what happened just before he came to our urgent care.
All right, so we had a teacher from a local school district come in from a student-teacher basketball game complaining about a pop he heard in his ankle area. He said he was playing, he landed on his foot, and he heard a pop. And after that, he was kind of down. He couldn't really walk on it properly. So he came to us immediately after the school got out.
Okay, excellent. Very good. Yeah, so this was a gentleman. He was about 45 years old.
Yes.
He was he's actually a coach, and he was participating in one of those teacher-student kind of basketball tournaments. So he had stretched and done everything properly, and it sounded like when he jumped up, he was fine. But when he landed, he sort of felt something pop in his right ankle, and after that, he couldn't put weight on it.
Correct.
All right. So when he walked into the urgent care, can you describe sort of how he was walking?
He had crutches and he had a cast, but he was still hesitant to put any pressure on the foot.
So you've already mentioned one of the anatomical issues that we have to worry about. So whenever people talk about their ankle, the ankle is actually made up of several different bones, several different muscles, and several different ligaments. And so the Achilles is always one of the more severe ones. Now the Achilles is actually a tendon. Okay, so a tendon is like a thick, almost like a rope or a rubber band, and it connects the muscle of the calf to the heel bone. Okay, so it's a very, very thick tendon. It's one of the largest tendons in the human body. Now, the name of the calf muscle is called the gastrocnemius. So the gastrocnemius is a very large muscle. It's the calf muscle, but it has two bellies. So it actually has two sides to it. They almost look like butterfly wings. And then at the bottom of those butterfly wings, it turns into the tendon. And then if you go all the way down, it'll touch the bone. Okay, so the Achilles tendon is a very, very delicate but a very important part of the human body. So when he came to us, he actually had borrowed crutches from his school nurse. I think that's how he got those when he came in. What did we do for him? How did we examine him, and what did we do while he was here?
And when we took off the cast, we could notice already that there was a swelling on the foot. And so we had him do x-rays from laterally and from the oblique side. And it was very hard for him to keep his foot down, as you can imagine, the pain for an Achilles could be very severe.
Makes sense, exactly. So in the urgent care and in most clinics like ours, we have digital x-rays on site. So we can do rapid x-rays. So we took him back, and there's special views that we have to do to identify, again, the bones and some of the other structures. Now, x-rays always show us bones very well. So that's always the first test. The Achilles is a tendon. So tendons don't actually look like bones because they have a softer kind of consistency. So we had to do multiple views. Lateral view means it's from the side. Oblique view means it's on an angle. And then there's an AP view, which is a frontal. So we do 3 different x-rays to maximize what we can see on the x-rays themselves. He was pretty uncomfortable. He wasn't able to really straighten his foot or bend his foot, but you could see the swelling in the calf muscle going down towards the Achilles. And so when we looked at the x-ray, can you describe sort of some of the things that you saw on the x-ray?
So we noticed there was a shadowing at the heel, which indicates a swelling of the Achilles.
Mm-hmm. Exactly. So you're right. So normally if you do x-rays on a perfectly normal person, you're going to see the anatomy pretty well. And whenever there's swelling, that can be inflammation. If there's blood, it actually shows up as well as swelling. And if there's any effusion. So effusion is swelling that's not blood. It's like a clear liquid. And I like to think of it as the airbag of the human body. So if you twist your ankle the day after or 2 days after it gets swollen, your body has an airbag, kind of a system to prevent you from putting weight on it. Because even if you didn't break it the first day, the body's afraid you're going to break it the second day if you put more weight on it. Mm-hmm. So the swelling is always expected in ankle injuries. And in this case, we did see swelling where we expected it. Now, a little bit above the Achilles, where the gastrocnemius muscle is, the calf muscle, there was also some shadowing. And so that's where we had to kind of decide, is it really the Achilles that was injured, or is it the gastrocnemius muscle? And for that, we would have to send him for an MRI. Do we have MRI at our facility?
We do not have an MRI at our facility.
We don't, and that's the dilemma. So MRIs are the most accurate because they're three-dimensional, but it takes about a week. You have to get it approved by your insurance, you have to get it scheduled, and then you have to get the results read by a radiologist. Now, our patient did have it read by the radiologist. He had his MRI this morning, and it did confirm that he had a tear of the Achilles tendon. So tell me about that. So what do you know about the Achilles tendon? What is the job of the Achilles tendon?
So the Achilles is a strong fibrous cord that connects the muscles in the back of your calf to your heel bone. So if you overstretch your Achilles tendon, you could tear it, which happened to our patient last week.
Very good, yeah. So exactly. So the Achilles tendon is used for raising and lowering the foot. It has to be in a very special location in order to function properly. In this case, a tear of the Achilles is going to be bad news. There's three different types of tears. So there's a mild tear, which is what you described, where you can just kind of overstretch it a little bit too much. You feel a slight pop, and after a week or 10 days, the swelling goes away and actually heals itself. There's a moderate tear where it can be partially torn a little bit deeper, like about 50%, and that may or may not heal, but it's going to take about a month or more for that to improve. And then there's a complete tear. So our patient, unfortunately, had a complete tear of the Achilles tendon. What do you think the next step in his treatment plan would be?
For a complete Achilles tear, he would have to get a surgery in order to repair the rupture.
Exactly. So the dilemma with tendons is that they're so strong that when you tear them, they actually pull apart further. So the Achilles tendon is like a rubbery material. So when it's torn, it pulls itself in opposite directions. So a complete tear will never find its way back. And those people have to go to an orthopedic specialist. They have to have surgery in order to stitch the Achilles tendon back together. And then they have to wear a cast, like a solid cast, with crutches. They can't do any running, can't do any jumping. Even going up and down the stairs is pretty difficult. Now, the difficulty with the surgical part isn't just the surgery. It's actually the post-operative rehabilitation. So it takes months for people to heal after the surgery because they have to strengthen their Achilles again. So people who've had an Achilles tendon tear, their season is done. And we were talking earlier about some famous people recently who had an Achilles issue possibly.
Correct. So Kevin Durant of the Golden State Warriors is playing in a playoff game against the Houston Rockets. And in about the third quarter, he landed awkwardly on his foot. And it seemed fine. He ran about halfway down the court, and then he just started limping out of nowhere. Obvious pain, and was taken to the locker room for further evaluation.
Exactly. And that is, again, a very common sports injury. And if you look at the video, it's all over the internet. You can actually see the video. He was standing by himself. Nobody touched him. He didn't land on any other player. It just happened spontaneously. And if you look carefully at his face, when that happened, he actually turned around because he thought somebody kicked him. And that's actually one of the common descriptions. So a popping sensation in the back of the heel or a kicking sensation. People swear they were kicked or struck by something, and they turn around, and there's nobody there. So that is a classic presentation of an Achilles tendon tear. Now, are there other complications that you're aware of or other issues that we have to be careful with in this situation if a patient goes to surgery? Yeah.
In case of Kevin Durant, this is a very big playoff game, and he has a lot going for him and his team. So if he were to tear his Achilles and it gets confirmed by an MRI, he wouldn't be able to play for possibly 9 months to a possible year. So that's that's about a season for the NBA player.
Exactly. And this happens every single day. In the NBA, it happens in football, it happens in baseball. So players who have any type of Achilles tendon tear, they're basically done for the season. And that can be the difference between $1 million contract and no money at all. So it is something that we have, found that it's very hard to recover from. And these are elite athletes. These are people who go to the gym every day, people who are very athletic. They have trainers. They know all the right things to do and things to avoid, but it continues to happen. Now, medically speaking, for example, if we have a patient who's 60 years old, they're probably not playing basketball. They're probably not doing other things like that. But it's interesting, there can be other causes for Achilles tendon tears. One of those causes can actually be antibiotics. And there's an antibiotic called Levaquin. Levaquin is related to Cipro, and this antibiotic is used for pneumonia. So there are cases where people have pneumonia, they have an infection in their lung, they go to their doctor, they take Levaquin, and their Achilles tendon ruptures. We have no idea why this happens, but it's so common now, there's actually a black box warning. So if we have to prescribe that medication to a patient, we have to let them be aware that they can actually damage their tendon because of that. And so that has nothing to do with sports, but it's actually a side effect of the medication. Now, other people can also be at risk. So people who are overweight, people who are pregnant, people who start a new routine. For example, they start running or jogging and they've never done that before. Most likely they're going to get a tendonitis, which means inflammation of the Achilles tendon. But if they keep doing the wrong activities, or if they're not careful, then they will get a partial tear or a complete tear. So again, we talked about a couple of examples with basketball, but this can happen with just about any sport. Now, what we will do is update our show notes, and I'll have some links online, and you can actually look at the Achilles tendon and the anatomy that goes with it. And I do recommend you take a look at that video of Kevin Durant, and hopefully you can follow through with his history and his management, and then you can see on a famous athlete what they do for him. But I wouldn't be surprised if he's not able to play if they do confirm that it's an Achilles tendon tear. So I want to thank Faaiz for being our guest today. I appreciate all your questions you had, and I do look forward to having you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emran on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.